Let me introduce myself. I'm Dr. Edwin Roth. I'm a child and adult psychiatrist and psychoanalyst practicing in Southern California for the past 20 years. I moved here because of my health, could not survive in the cold of the Northeast. I trained in pediatrics at the Bronx Municipal Hospital Center, completed my internship, and then was drafted out of my residency during the Berlin Wall crisis. And I served in the United States Air Force as a member of SAC during the Cuban Missile Crisis. After I was discharged, I returned to Cleveland and completed my residency in adult psychiatry and the fellowship in child psychiatry. I then was the child psychiatric consultant to Babies and Children's Hospital for a year, and then became the director of the child psychiatry outpatient department. After a number of years, I went into full-time private practice and psychoanalytic training, which I completed, graduating in adult and child psychoanalysis. I practiced full-time in Cleveland until my health required me to move to Southern California. When I came out here, I practiced in the outpatient department in my own practice and with the Riverside County mental health clinics, and also in the state prison at Chuckawalla. To my surprise, I encountered a group of patients I had not seen previously, nor had heard of previously. As I researched these patients, based on their symptomatology and their findings, I could find no other mention of them. During the course of my time here in Southern California, now I've seen about 500 of these patients. After I saw about the first 300, I came to some conclusions about their diagnosis and treatment, and I published a book, the Post-Lsd Syndrome. And then after publishing the book and gaining more experience with the condition, particularly when I became the director of an inpatient psychiatric ward, I then published the second book, the Post-Lsd Syndrome. You could get more information about these books and about the condition, other than what I'm going to tell you here today, by going to my website, which is available at edwinrothmd.com. On that website, there's more information about both books, and you can order the books directly from the website. I became interested in these patients because I encountered quite a few. There were perhaps 5% of the new patients that I saw in every setting that I have worked in that had this condition and suffered immensely from it. They had very severe symptoms, and the symptoms were extremely debilitating and very difficult to treat. All of the patients that I have seen received unsuccessful, rather unhelpful treatment, which was mostly palliative. Many patients sought addictive substances to try to relieve the symptoms of the condition. There were four major symptoms that were apparent from the outset. The first symptom complex was of severe incapacitating anxiety, usually bordering on panic, and it often drove the patients to go to emergency rooms to try to seek relief. A number of patients were hospitalized because of concerns about an impending heart attack, but none of them ever had heart attacks. The anxiety was very severe and very reminiscent of a kind of anxiety that was referred to as LSD anxiety, when LSD was first becoming popular and achieved considerable usage and notoriety. The second major symptom group was of insomnia. Most patients had very severe insomnia, and it was related to what they called racing thoughts, which kept them from falling asleep, and horrible nightmares, which awakened them when they were asleep. The horrible nightmares were very unusual. They were vivid, horrifying, terrifying, and bizarre, and were of a nature that usually is not seen except in a psychosis or in a delirium. The third major symptom group these patients suffered from was impairment of intellectual and cognitive function. The patients reported difficulty in concentrating, difficulty in focusing, feeling distracted, having trouble thinking clearly. They felt they could not work or perform in school properly. Many patients lost their jobs or their businesses went bankrupt as a result of their poor function. Many patients dropped out of school rather than be kicked out for poor school performance. They often had trouble reading. They could even have difficulty watching television or sitting still and playing a game. The fourth group of symptoms had to do with emotional ability. Patients experienced surges of emotion, both anger or tearfulness, and were unable to control these surges at times, or at times feared they would lose control themselves. These symptoms represented what I call the basic condition of the illness. Initially, most of the patients that I saw fit into this condition, and I felt that I was seeing patients in an acute phase of the illness. And I wrote this up in the first book. In the first book, I also thought that there were patients who had remissions and exacerbations, and I felt that the exacerbations were renewed acute outbursts of the condition. As a result of seeing the latter group of 200 patients that I report in the second book, I came to a different conclusion about this and recognized that there is a chronic condition which patients have. The chronic condition is really a condition that results from patients having this extreme condition for several years and becoming exhausted, depressed, discouraged, and basically depleted because of the symptoms and the effect of the symptoms, namely causing them to be unable to function properly and causing their lives to basically fall apart. Many patients became divorced as a result of this condition. The patients were also very discouraged because all the medical help they received usually focused on antidepressants or anti-anxiety medications or drugs like the painkillers and the opiates. And may have taken the edge off of their symptoms to some extent, but not sufficiently to enable them to function well. As a result of becoming discouraged and exhausted, most patients that I saw had turned to addictive substances. The most common addictive substance that these patients used was alcohol. It seems that alcohol had a particularly beneficial effect in being able to numb the patients so that they had less severe anxiety and were able to sleep somewhat, but overall the general function was not good. Let me say a few words about the addictive substances, particularly alcoholism. Many patients who used alcohol viewed themselves as primarily alcoholic and lost sight of the basic condition that had caused their pain and disability. Virtually all of the alcoholics that I saw functioned on the alcoholism, and when I asked them why they were alcoholic, reported that that's just what they were. They were alcoholic. I had to question them to learn about the basic condition as existence. Early in my exposure to these patients, I saw a number of patients who were alcoholics intermittently and who had been able to finally, by force of character and strength of character, stop drinking and use substances very minimally, including the antidepressants or other prescribed medications, and sought to restore normality to their lives, to function and work, and seemed to get along all right for even as long as a year. But then they became unable to maintain that, and they felt a need to return to alcohol. Virtually all of them said that they were alcoholics, and that's why they returned to alcohol. But on closer questioning, it turned out that they were beginning to experience the basic symptoms again, particularly the anxiety and the insomnia, and turned to the alcohol to try to control those symptoms. They usually were unsuccessful and were very discouraged. And many of them lost their jobs, their businesses, and their marriages as a result. I describe many of these cases in the books. A very surprising thing happened as I was talking with the patients early in my experience with this condition. Many patients brought a connection to LSD. Many asked me, could this be caused by LSD? Because they felt that they were reminded by the symptoms of LSD as they experienced some of the symptoms of their new illness. They were not having severe crises, as with the acute intoxication with LSD, but they did experience something that reminded them, whether it was the quality of the anxiety or a smell or a tightening of some muscles. Many patients had a memory of the LSD experience that was rekindled as they experienced their current symptom. Interestingly, very few patients had visual hallucinations or distortions. As this connection to LSD was brought to my attention by the patients, I began to reflect on that. And then it became very clear that these people had experienced LSD and that this condition, which I have termed the Post-Lsd Syndrome, developed around a year after the initial use of LSD. People might have used LSD only once or numerous times and then experience the onset of this condition within a year or even decades after their first experience. Let me describe a patient for you. She was one of the first patients I had, and give you maybe a flavor of what these patients go through. This was a 42-year-old intelligent woman who had developed the condition about 2 years previously, experiencing severe anxiety, severe insomnia with horrible nightmares, interference with her intellectual functioning. She was a very bright woman and outstanding in her job, but she felt that she was no longer functioning as well as she should. And she could conceal it because she was so smart, but she knew that her work was coming with more difficulty and she didn't understand why. She thought it might be because she was premenopausal. At this point, I already had some inkling of the connection to LSD. So I asked her if she had ever used LSD. She said no, she had not. And I was surprised. I wondered if perhaps she had ever had an episode where she thought someone had slipped her some LSD. And she remembered a party when she was 17 years old where she thought that her boyfriend had slipped her some LSD because he was using it and had offered it to her and had been disappointed when she turned him down. She had a very bad episode as a result of this LSD contact. She became agitated, fearful, paranoid, began to have visual symptoms where the walls seemed to be moving in on her. She felt very frightened, as if something terrible was going to happen, and she could not settle down. She did not sleep that night at all, but gradually recovered. By the next night, she could sleep, and then she said she gradually got better, but she never got fully recovered. She always felt somewhat distracted and with some inability to focus and concentrate clearly. Nevertheless, she was able to go to college, have a life, and did fairly well until her acute outbreak, some 20 years plus after her initial episode. I, at this point, felt that LSD was the culprit, and based on that thinking, I treated her with an antipsychotic medication. And to my great surprise, she improved remarkably. By the next week, when I saw her, she no longer had severe anxiety. She no longer had trouble sleeping at all. Her thinking was improving dramatically. And over the next few months, she recovered completely and was totally asymptomatic. One could not tell that she had ever had the post-Lsd syndrome after a few months. We lowered her medication, and after a few months, she decided she was well enough that she did not need treatment anymore, although she would continue the medication. That's been my experience with all of these patients that I've seen. They all respond extremely well to antipsychotic medication, but there are some surprising issues. I'll not go into those in detail here, but of course they're in the book. The patients require a remarkably low dose of medication. Some patients require what I would call a homeopathic dose, a dose so low that I would never have expected that it could help them. If the dose that they receive is more than they can tolerate, they experience very unpleasant side effects, which make them unwilling to take the medicine. And when they're having these kinds of side effects, they don't seem to benefit that much from the medicine. When the dose is reduced and they get the right dose, then they improve very well. The other surprising feature of the treatment is that although they respond so well to the medicine, really become asymptomatic. They require the medicine for a prolonged period of time. Patients often required a very, very low dose of medicine years after the onset of treatment, or else they would have a recurrence of symptoms. In the second book, the Post-Lsd Syndrome revised edition, that's this book, I discuss, in addition to this basic condition, what is the chronic condition. That is a condition that develops after patients have had the illness for some period of time and no longer can function without using an addictive substance. The most common substance, as I have said, is alcohol, and they also have, other patients have used cocaine, heroin, and opiates. Some patients use marijuana and amphetamines. The other, and I discuss these issues in the book, the other issue that I want to mention is that the chronic patients all are depressed, but they generally mask their depression because of the use of the alcohol. And very few of the patients that I saw who were viewing themselves as alcoholic also talked about being depressed. The depression seemed to numb them, or rather the alcohol seemed to numb them, both from the symptoms of depression and the symptoms of the basic condition. There was one patient who stood out in this group of patients. He was the only patient that I saw who made a serious suicide attempt. And he made such a grimly suicidal attempt that he actually succeeded, but was accidentally, luckily found, taken to the emergency room, and kept on life support for a week and recovered. Once he recovered, he still was very suicidal. And at that time, he was hospitalized on a highly secure psychiatric unit for 3 weeks, where he did not improve at all. And for some reason that was hard to fathom, they decided to transfer him to my low security, minimal coverage psychiatric unit. We have at a maximum stay of 2 weeks. The unit was unlocked, and it was for patients who were doing pretty well and who we hope to be able to treat effectively in a short time and returned to the community quickly without an intensive hospitalization. He was transferred to my unit, and he was grimly suicidal. The staff were very worried about him, as I was when I met him. He clearly was suicidal, clearly felt his life was worthless, that because of his severe alcoholism and his repeated failures to stop the alcoholism, his wife had decided finally she could no longer tolerate him and his condition and his loss of his business, and was divorcing him. He felt at that point that life was not worth living and he was going to suicide. His wife wanted nothing to do with him in our unit until she felt that he showed some improvement. And thankfully, with the medication we used, he did improve, as all the other patients had improved. And within the 2 weeks that we had available to work with him, he basically lost his depression and felt hopeful that he could resume his life. So I'm going to stop now. That's a brief overview of my books and the condition. It has not received any notice. There are a lot of people, I fear, who have the condition and are not being treated. And I hope that, to help them gain the treatment that they require. If you have any questions, I'll be glad to try to answer them for you. And I have on my other website, you can email me and I'll answer your emails on that website. Thank you very much. This is Dr. Edwin Roth signing off.